Good day, everyone. I'm Jan Allen M. Distao from BSN 1C Group 2 at Central Mindanao University. And today I'm going to perform our return demonstration on assessing the neuromuscular system, the cranial nerves. So in preparatory phase, first is you're going to review or reassess the client's previous medical records if available. Then you're going to determine the scope of assessment needed and prepare necessary equipments. So here are my equipments. Then we're going to perform hand washing and don gloves if deemed necessary. So here is my alcohol-based hand rub, and I'm going to perform hand hygiene. This is to prevent or avoid the spread of microorganisms. Next is we're going to assemble the equipments needed and the supplies needed. So this is to make the procedure smooth and coordinated. So I already assembled the equipments and prepared the necessary supplies. Next is we're going to introduce self to the client and verify the client's identity. This is to ensure that the right person will be assessed or will be assessed and to help prevent errors, and also this will also serve as a good way to establish a rapport with the client. Good day, sir. I'm Jan Allen M. Distao, a student nurse. I'm your student nurse for today. So, may I ask your name, sir?
John Mark Melocotones.
Okay. Your birthday.
June 25, 2006.
Okay. Your age.
15.
Your religion.
Roman Catholic.
Okay. Civil status.
Single.
Okay. So, how would you like me to address you, sir? What should I call you?
John Mark for short.
So, Mark or Mark?
Mark.
Okay,
Mark.
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 Okay, Mark.
Sorry, Mark.
Okay, sir, Mark. So, next is you're going to explain the procedure to the client, and so this is a way so that the client will have knowledge in regards of the assessment. So today, sir, is we're going to assess your neuromuscular system or cranial nerves, which is we're going to test your hearing, your sense of smell, your taste, even your sensations, reflexes, and eyesight, and any vibration or any sounds in regards with your hearing. We're going to test that, okay?
Very nice.
So next is you're going to position the client comfortably and provide privacy. So assuming that we are in a hospital setting, so you're going to close the curtains around the patient's bed, and you're going to close the door and windows so that the patient will feel at ease and private. So, are you comfortable with your position, Sir Mark?
Yes, nurse.
Okay, very good. So, before we start our assessment, do you have any concerns? Basta gusto pa kang mangihi, sir? Or wala na?
Wala na, nurse.
Okay, we're good to go. Mag-start na ta, sir?
Okay, nurse.
Okay, sige. So, moving on to the assessment phase. So, first is you're going to assess the mental status of the patient. So, this is useful in helping differentiate between a variety of systemic conditions as well as neurologic and psychiatric disorders ranging from delirium and dementia to bipolar disorder and schizophrenia. So first is we're going to assess the level of consciousness of the patient. So prior to that, we're going to ask the client some questions, or we're going to interview the client. So again, sir, to assess your consciousness, level of consciousness, may I ask again your name, sir?
Junmark Melocotones.
Your address.
Propono, Bogak District, Mangagoy District City.
Okay, good. Do you know the day today, sir? What day today?
July 28. Wednesday.
Okay. Okay, very good. Do you know where you are today, sir?
In the hospital.
Okay, very good. Next is you're going to observe the appearance and behavior and speech. But before that, in the level of consciousness, normally client is alert and oriented to what is happening at the time of the interview and physical assessment. So responds to your questions and interacts appropriately are normal findings, and on the other hand, it is not normal if the client is not alert to person, place, day or time, and does not respond appropriately. So next is we're going to observe appearance and behavior and speech. So I've already observed the appearance, the behavior and speech of our client. So normally the client is dressed appropriately with the occasion and weather, and dress varies depending on the individual's perception or preferences. So also client is also clean and groomed appropriately for occasion. And in the behavior is cooperative and purposeful in his or her interactions with others, such as myself. Then in speech, it is in a moderate tone, clear and with moderate pace. So furthermore, responses may sometimes be slow. So on the other hand, uncooperative, bizarre behavior may be seen in angry, mentally ill, or violent client. So it is a abnormal finding, or it is a disadvantage, or the opposite of the normal. So anxious clients are often fidgety and restless. So some degree of anxiety is often seen in ill clients. Then moving on to the next procedure is we're going to observe the mood, feelings, and expression of the client. So how are you feeling today, sir?
I'm okay, nurse.
So aside from being okay, also pa man, sir, basta so pa in the feel good today. Happy ka, relax, or sa?
I'm so calm, at rest, relaxed,
Okay.
and I'm happy.
Okay, very good. And also, sir, what are your plans for your future, sir? Sir Mark.
Ako pangan doon ay may mo police nurse.
Okay, may mo police. So, since grades, high school pa mga karon, sir, no? So, you're dreaming, or you're hoping to be successful. You want to be successful in your studies.
Yes, nurse.
Okay, gusto ko maning kamot kag eskwela unta makapasar ka.
Oh, nurse.
Okay, that's good. So, normally, client is cooperative or friendly, expresses feelings in an appropriate manner, or in regards of the situation, verbalizes positive feelings regarding others and his or her future, and also expresses positive coping mechanisms such as hobbies, or his dreams, expressing his feelings very well. So, on the other hand, flat affect, euphoria, anxiety, fear, and irritability, depression are all examples of altered mood expressions. So next is moving on to the next procedure. So observe cognitive abilities, thought processes, and perceptions. So, tell me more about what you just said, sir. So you are trying to do your best. You want to become a police. Ano gusto mo ka ma-police, sir?
Para makatabang sisig ka tao, nurse.
So gusto ko makatabang sa isig katao nato, labi na sa kanang mga unsa mga gusto ka mo dakop gid mga criminal sir
Oo, nurse.
para na justice.
Yes, nurse.
Okay, that's very good. Okay. So normally, the client expresses full, free-flowing thoughts and uh, expresses realistic perceptions. It is easy to that are easy to understand and make sense. So, abnormal processes include persistent repetition of ideas, illogical thoughts, interruption of ideas, intervention of words, or repetition of phrases. So, it is an abnormal thought process. So next, moving on to the assessing of cranial nerves. So we are now going to be assessing the cranial nerves. So it is used to identify problems with the cranial nerves by physical examination. So each test is designed to assess the status of each or of one or more of the 12 cranial nerves. So for all cranial nerves or for all assessment of the cranial nerves, so we're going to have the client sit in a comfortable position at eye level. So starting at the cranial nerve 1, so we're going to test the cranial nerve 1. Okay, sir, comfortable naman kasi mong position, sir, no?
Oo, nurse.
Okay, sir, now I want you to close your eyes, then cover your one nostril. So, cover ka sa imong ilong gamay, sir. Ana nimo, sir. Now, I want you to smell it, sir, if unsa imong na-smell. Okay, sir. I want you to smell this one. So, na, sir.
Perfume.
Okay, very good. Wait, sir, I'm just going to get my thing. Okay na, sir. So, next nostril na po, sir, sa pikas. Close your eyes again. I want you to smell this one. So, muna, sir.
Coffee.
Okay, very good. So, normally, client can tell or identify the okay na, sir, you can open your eyes na, sir. The object or the thing that you instructed him to identify. So next is we're going to test the cranial nerve 2, which is the optic visual acuity and peripheral vision confrontation test. So now, sir, is we're going to check for visual acuity. So I want you, sir, to read this one, sir. So I want you to cover your one eye. So we're going to try the right eye. So I want you to stretch, so to hold this like this, sir, with your arms. Okay, so that, sir. Then I want you to identify or read this line.
E-E-Z-O-L-G-F-T-D.
Okay, on the other eye. Okay, sir.
57823.
Okay, very good, sir Mark. Next is we're going to check for a visual field. So in assessing the visual field is you're going to face the patient directly and ask the patient to look into your eyes and then place your hands 2 feet apart lateral to the patient's ears. Then you're going to slowly move the fingers until the patient's